Botox as a cosmetic treatment has been used probably for the past 20 to 30 years. So that should really reassure people that it's a treatment that's been around for a long period of time, it's tried, it's tested, no major long-term side effects have come to the fore, and there are probably people out there who've had it done for 30 years and who are absolutely fine. That should reassure people that this is a treatment that is quite safe. Botox is what we call a neurotoxin. In other words, it affects the nerve that supplies a muscle, and if that muscle can't get any messages, it doesn't know what to do, it relaxes and appears frozen. And this, in the cosmetic industry, will give us a more relaxed face, less lines and wrinkles, perhaps a lifting or an equalising of asymmetry in the face. I've been performing Botox as an aesthetic treatment in my practice for about 10 years, which means I'm a very experienced Botox practitioner. Even so, I would attend regular training updates to make sure that I'm at the forefront of my field. I would always use branded Botox. I think there is no compromise. I can predict from using that the sort of effect that I can produce in any of my patients' faces. When considering Botox as a form of treatment, patients should appreciate that it isn't a lifelong treatment, that you have it done once and that's it. It is a repeat procedure and would need to be repeated every 3 to 4 months with some people, maybe after some considerable period of time of having it, maybe 5 to 6 monthly. But like any anti-aging treatment, we are continuing to age, and therefore we do need to continue with maintenance treatments throughout the course of our lives to maintain our youthful appearance. Botox is most commonly used in the upper face to help to relax a frown, which tends to make people look cross, lift open the eyes by injecting the forehead area, and also soften around the eyes, what we call the laughter lines, or with some people the crow's feet. At Woodford Medical, we use more advanced techniques also to inject Botox into the lower face. Here we can help to lift the corners of the mouth, redefine the jawline and tighten the neck area. Many people who are often considering Botox are concerned about the look of some of the celebrities out there. A bit too frozen, a bit too fake, can't move a muscle. They don't want to appear like that. They want to look nice and natural. They want to look like they look well and not have people thinking that they've had any treatments performed. That's very important. Very important to me is to create a natural look for someone. And Botox done with a very natural look in mind is now the trend that seems to be developing. Less of the frozen, more of the natural look. Sometimes the term baby Botox is coined, and this has been written about in several articles in the papers. This is exactly what we undertake here at Woodford Medical with our treatment regimes. Botox is for the treatment of excessive underarm sweating or sweating of the hands and feet. Essentially, the Botox works by stopping the sweat gland from producing any sweat. It's a very effective treatment and really only needs to be undertaken every 6 to 7 months. So a lot of people with a problem that occurs mostly in the summer when it's very hot, or if they're involved in board meetings or presentations at work where they do get very wet under the arms, can really get great improvement by using Botox as a form of treatment. Patients attending for the first time for some Botox treatment will have a consultation with either myself or Dr. Patterson, and we will put them at their ease with regards what to expect from the treatment, what their concerns are, what their expectations are. We will talk about Botox, explain the whole procedure. We will take a full medical history, to ensure that they are fit and well enough to have this sort of procedure undertaken. We will also take a series of photographs what we call before and afters. So it's then nice to look at how you look before and after your treatment when they come back for their review at a 2-week interval. This is standard procedure in our practice to ensure that everyone is happy with what they're having done. We can't really get away from the fact that Botox is a series of injections where the Botox is placed into the skin, but tiny little needles are used to affect this. Minimal discomfort associated with it. In fact, I would probably say it's one of the least uncomfortable procedures that I undertake in my practice. Only takes about 10 minutes max to do a whole treatment, including upper and lower face. So people don't find that it's very distressing to have this performed. I reassure them throughout the procedure, and most people get off the couch saying, well, is that it? Which is obviously always a good way to finish a procedure. Botox always takes about 2 weeks to work completely, and at that time we like to see our patients again, review them, check that everything is absolutely spot on as far as the injections are concerned. We can take that opportunity to do the odd little tweak here and there if we feel it's necessary. It's also an ideal time for us to take another photograph, and we can compare the before and afters, and we can show these to the patients and they can see what improvement that they have gained by having the Botox injections. So it's a nice way to start off their Botox career for them.